being injured in football games and rugby. People with this condition hallucinate more. Before losing faculty, they start hallucinations like nightmares, see things, which is transmitted. Once they get it, they won't survive more than 6 months or 1 year. But middle-aged people where it's fast life, driving late, people sometimes ignore value of sleep. Quality of life improves at home. Cigarette smoking can cause constriction of blood vessels, lung disease. The hallmark of treatment of dementia is
It's my great privilege to welcome Dr. Bapuji Rao Velgapudi, a true pioneer in the field of psychiatry and mental health. Dr. Bapuji Rao working for NHS since 1973. He has recently awarded the Lifetime Achievement by the British Indian Psychiatry Association. Dr. Bapuji Rao involved in dementia clinical trials, establishing community mental health units, Blackwood Alzheimer's Society, Welsh Psychiatry Society and charity in back home in India. Please welcome the incredible Dr. Bapuji Rao. Thank you, sir, for joining us.
Namaste Shyam Kumar Garu. Namaste also to our friend Surya, who initially asked me to help this program. It's a privilege for me to talk to you today as well as to your wider audience across the globe. I will do my best to help you with the questions related to health matters.
Thank you, sir. So if you could summarize my introduction and if you add anything, that would be really great.
I think you use the word incredible is the right word, because when we came in 1973, after I did my MD in All India Institute, which is a major institute in India, our initial expectations were different. National Health Service in 73 was totally different. Nature of conditions were different. Even the dementia we are going to talk about is not at this pace. And then in 73, I had experience initially in East Anglia, followed by London with Royal Free School of Medicine teaching, and then some work in Midlands. And since 1987, I am in South Wales. So I did general psychiatry initially, and then took the specialty of old age mental health, which was quite coming into vogue in this country in 80s and 90s because of the growing elderly population, one, and also increased mental health issues in older people, and of late dementia and other degenerative conditions. So I'm happy I took this specialty because we are able to help a large number of elderly people here and also advise our folk at home where this problem is gradually expanding.
Sure. It's a right place, so your efforts from last 50 years, now you can do so much helping the even UK on back home.
When we came National Health Service initially, it is a different planet for us. Like in India, there was no nationalized health service, mostly private sector, with only limited general hospitals. Here it was real interesting to see is all government funded. The health is provided from birth to death and non-fee paying, only for rare situations you have to pay. So it is a quite interesting journey. Of course, National Health Service and doctors like me coming from our countries all working also has gradually become better.
Sure.
Initially, there were problems for people like us to get higher qualifications and higher, but now I think we are more acceptable because a large amount of National Health Service is served by people from outside, from across. From rest of the globe.
Sure.
Yeah.
Sir, we want to start with impact question because since we are the impact, what impact you would like to create?
Yeah, that's a very good question, also a difficult question. I think we have to talk of impact on the society where I am working now and the UK as a whole, and probably impact on our mother country and also our own state we come from, I suppose, because we are always attached to our where we come from. Where I work in South Wales, I did what I can do because the National Health Service, there's a great deal of evolution. It's not like including our countries where things are not at status quo,
Sure.
always moving, advancing. So we have to keep with so many changes. So I was able to help with those changes.
Okay.
When I came in 1987 to Wales,
Right.
we had a large asylum type hospital called Pennywall Hospital in Abergavenny
Sure.
with 2,000 population. But already there's a national program to close asylums.
Okay.
So initially my job was to gradually reduce the number of beds, which means closure is a bad word. What it means is not closing, we are opening more community mental health services.
Right.
So they are not being abandoned,
You're shifting.
shifting.
Yes.
But the patients are not being abandoned. They're not.
Right.
It's not like closing hospital and throwing them out.
Got it.
So developing a community mental health service
Yeah.
was a very strenuous job
Right.
because you have to convince the local population, local general practitioners,
Yes.
relatives to accept these people, and also help to improve the structure in the society to look after these people in the community. So from 1987, it took until 1996 to close this hospital.
Hospital. Okay.
Of course, we are not the only one by the time that movement is going on in UK. And UK is a model. When they started asylums in late 19th century,
Sure.
these are the first time they had these big mental hospitals. And India followed later on. And they also are the first people to do restraint. And so these are the first people to remove the restraint.
Restraint.
It's a
Sure.
national reform
Right.
when famous psychiatrists brought the concept of removing the restraint, isolation, padded cells and all that. So now moving to that to go into community is a different step. There's one impact we were able to make. I think local society is very grateful. And following that, we moved into locality, small community units. Now, our inpatients, outpatients are run, if you have 5 boroughs, for example, like equivalent of our districts in India or
Okay.
counties.
Sure.
Each county or district has got its own mental health unit. So there I'm able to do a great deal of outpatient community service. The second impact is I always practice domiciliary visit concept. In India, doctors don't do that much. Here, hospital doctors visit the patients at home.
True.
So people are surprised when I tell in India,
Yeah.
our regular job is to visit people at home.
Yes.
Because very elderly people, visiting them at home is very crucial because you are visiting them in their own environment
Yeah.
with their family and relatives.
It's giving
So-
you assurance.
Assurance, and
Assurance.
also you get the correct picture. Because when they see them in the hospital clinics,
Sure.
they get a bit more confused and get lost,
Yeah.
like we are in this interview.
Absolutely.
So
I-
at home they're in a more natural environment.
I can see your points. This is your more dementia. It's more about the environment, people as
Brilliant.
well. Its impact. So you going, visiting them, and assessing them is different. You will get the right picture. At the same time, the patient will have kind of assurance.
And also we are able to assess the home situation, their accommodation.
Sure.
Do they have all the facilities? Because these patients not only have mental illness, they have a lot of physical conditions, safeguarding. So many assessments can be done.
Sure.
But that has changed now. At present now, other members of the multidisciplinary team visit the patient more than us, like social workers and community nurses. And they make the report of home environment and bring it to our multidisciplinary team meetings.
Sure.
So other impact may be my link with various diaspora associations.
Okay.
Like I'm one of the founders of the British Indian Psychiatric Association,
Yeah.
which actually has got the largest members after Royal College of Psychiatry,
Wow.
because a large number of Indian psychiatrists working.
It's an UK based.
New
The big one.
dimension.
Yeah.
So there we have annual meetings. We invite psychiatrists from America and India. So I'm glad that I was able to do my bit to help that association.
Great.
And the second association I am active now is BAPIO, which is British Association of Physicians of Indian Origin.
Okay.
It's doing a tremendous job to help. It's a bit political,
Sure.
help our doctors who are in problems, discrimination, racial problems, and problems in going up in their career ladder. So BAPIO is doing a wonderful job in that direction. So I'm able to contribute to that.
Sure.
And the other impact probably is at home. So I was able to help people in the village. We built a community hall. You know, in this country, we take it for granted. Every village has a community hall.
Yes.
Like they have a post office.
Yes.
In India, there are no community halls.
No.
Even to do a small function, they have to go nearest town
Yes.
or put a marquee outside the house. Of course, putting a marquee outside the house is good because the weather is very warm and open there.
Sure.
So this community hall, we are able to do some conferences, health programs. So these are the things that come to my mind at present.
Sure, sir. There is a 4 great impacts which you want to create. Already you're working on it. Great to hear that, sir. Thank you. And now with that question, sir, so let's start with the basics. What is dementia? What is Alzheimer's? What's the difference between dementia, Alzheimer's?
As you know, dementia is, I think, third or second most common killer in this country across the world.
Sure.
Of course, dementia alone doesn't kill, but there are associated conditions. Person becoming weak and frail secondary to it.
Sure.
So dementia is a common syndrome. It's a neurodegenerative disease where, as to put in an ordinary term, brain cells get atrophied, fall off, and they lose their faculties of memory, thinking, comprehension, and also what you call executive functioning.
Executive functions, yeah.
Even if they have an idea, they are unable to perform. Of course, ordinarily we say poor memory, but memory loss is only one aspect. Other aspects include I mentioned, and also lack of coordination.
Sure.
And changes in the personality and loss of skills. For example, person who is very good in playing golf may suddenly don't know how to play the golf. Or people who are very good at DIY at home can no longer do DIY. So they lose skills. So there's dementia syndrome in that wider. And dementia can be caused by a number of conditions.
Sure.
To give alcohol can cause dementia, alcoholic dementia. So that we may have to discuss later on in the well-being. And head injury can cause dementia. That's why recently there's a lot of political news. People being injured in football games and rugby. This is called chronic traumatic encephalopathy. Frequent knocking and then injuries.
Sure.
That's why I think they are bringing some changes. They should not do head bouncing of the balls and all that. And there are other conditions can cause neurological. But commonest condition, what we call senile dementia, before 1970s, 80s, is now called Alzheimer's disease.
Sure.
A German psychiatrist called Alzheimer's described that condition, is named after him.
Oh, okay.
So the changes in the brain also are described by his name, like Alzheimer's plaques and all that.
Plaques.
So Alzheimer's disease is our typical dementia which people ordinarily think like elderly person, gradual onset, gradual progression. They lose memory, faculties and other things I mentioned above. And finally resulting in very severe deterioration and a person being totally unable to manage. That's why Alzheimer's disease is very severe, dementia in general very severe.
Sure.
Because it's not reversible in most of the cases.
Sure.
So Alzheimer's disease is one type of dementia.
Right. Okay. That's the. Now I got the clarity. Sure.
And the other dementia, common dementias, which your audience want to know is, second one is vascular dementia.
Vascular.
Vascular dementia comes in people who had stroke, high blood pressure, mini strokes, we call transient ischemic attacks. They develop vascular, which is fluctuating.
Okay.
Alzheimer's disease is gradually progressive.
Right.
Here they fluctuate.
Okay.
Because it's important to see when they fluctuate, when they are not ill, not fluctuating, they can make normal decisions.
Okay. Sure.
So people with vascular dementia, when they're fluctuating, there are phases in their routine when they can make a normal document, the capacity. But gradually they also end up in Alzheimer's type deterioration.
Right.
And then third condition, we call it as Lewy body dementia. That's becoming more prominent because people with this condition hallucinate more.
Sure.
Before losing faculty, they start hallucinates like nightmares, see things, where you get confused, and that also deteriorates. But that its pathology is different from Alzheimer's.
Sure.
And next condition is called frontotemporal.
Granted.
That is Pick's disease. That is a very serious condition because, to put in a nutshell, when they present, they behave like mad people, very psychotic, aggressive. So behavior is more prominent than memory, very difficult to manage.
Sure.
And final thing is what is called Jakob-Creutzfeldt disease. That's the one our people will know like mad cow disease, which is transmitted by a viral.
Right.
And that's very, very highly mortal condition. Once they get it, they won't survive more than 6 months or 1 year. So these are so dementia is broad spectrum like this.
Sir, you mentioned the person suddenly he's got skilled and he lost that interest in that skill. That's a kind of one symptom?
Yeah, for example, nowadays, in the past, most people who come to us were past 65 years, pensioners, old age of retirement. Now we get a lot of people who are working age, starting from 40 onwards. So these people, they can do mistakes at work. You know, writing, they attend a meeting and they forget how to document the minutes.
Sure.
They go out of the meeting, don't remember what was discussed in the minute, which is a very dangerous thing.
Yeah.
Especially for a civil servant.
Yeah, sure.
So, and in the daily life, if a housewife, she may lose skills in recipes, cooking. And commonly, they forget to switch the cooker off, all those things.
Sure.
And daily chores, they forget sequence of things, like hovering and forgetting halfway through, leaving the tap open.
Sure.
And outside, men, for example, I know a lot of cases who play golf, no longer can play golf. And secondary to that, they also forget the names of their friends in golf. You know, golf is a very good social circle.
Sure.
Once they forget the names, they feel embarrassed to go and play golf.
Yeah.
Similarly, people doing gardening, they lose interest. And also people doing DIY tasks at home, they no longer put the light bulb. But you not an important point, losing interest is another facet, I think. They may have skill, but they may lose motivation. It could be due to dementia or due to depression along with dementia, lack of interest.
Sure.
So there's one aspect of it.
Right. That second question, sir, that exactly I want to ask, but you already covered. What are the easy signs of dementia? But you already covered that. So what are the late symptoms of dementia, sir?
For our people to know, normally we talk of mild, moderate and severe.
Sure.
Mild is when person dismisses it as part of normal life. Sometimes you call age-related memory loss. I think we have to promote it. Some amount of forgetfulness is normal to all of us.
This is a big confusion, isn't it, sir? Because even sometimes with my age, like, I forgot the things. I thought, like, I'm growing, maybe it's a normal. But after 50, 55, 60, so this would be usual. How can we differentiate that could be Alzheimer's or it could be age problem?
Yeah, we have
It's kind of challenging, isn't it?
we have a common saying in the profession: when you forget your wife's birthday, that is a serious thing. Until then, you can cope. You are right. Age-related memory loss. People come to us like that these days. As dementia has become very popular, they are afraid of dementia.
Sure.
Actually, this is compared to heart disease. You know, when heart disease is so prevalent,
Yeah.
some people with mild chest pain rush to the heart specialist.
Yes.
So it is a natural worry people get.
Yeah.
But age-related memory loss, still people get adjust to their life. They can compensate for it. But any memory loss, if is compounded with problems in daily life, daily functioning is the hallmark, I think, of the borderline, and also doing mistakes. I think age-related memory loss, we do mistakes, we correct ourselves, like putting things in wrong place, but they don't find it, or going upstairs and forgetting why you went upstairs. There's a common problem people come with. So it is depends on their dimension. If they are able to still cope with life, the age-related, the mild. Now there's a condition called mild cognitive impairment.
Yeah, sure.
That's very important. The MCI is very important because 1 in 5 or 1 in 10 with MCI can become Alzheimer's later on. So a lot of research is going on MCI. But coming back to your question, mild and then moderate.
Sure.
Moderate is the one when they start going to see the doctor, they get worried, concerned, they change their quality of life. And severe is severe when they become confused, disoriented, they do odd behavior, and they can no longer function. So most people who come to our clinics nowadays are mild to moderate. Many years ago, when people are not aware of it, we used to get commonly severe dementia people. Yeah.
You can prevent diabetes. This is similar to Alzheimer's. Can we do something about?
No, that's a very interesting point. I think I'm glad you said lifestyle and well-being, because whole medicine is filled with that concept now for all medical conditions, including for breast cancer, hypertension, stroke, and of course now dementia. I think your point is we have to remember dementia is only one aspect of the health disorder. Most people in old age with dementia have a lot of comorbid conditions. Patients I treat, we always say they are at least on 10 other medications.
Okay.
One for diabetes, for hypertension,
Sure.
and blood thinning tablets, for rheumatoid arthritis, for their respiratory conditions like asthma or emphysema,
Sure.
and for their eye conditions, so or heart failure. So the lot of comorbid condition is there. Coming to well-being, to Alzheimer's, the triggering factors. The cause of Alzheimer's, as you know, first there is some genetic component. We can discuss later on.
Sure.
We have to think of what are the acquired factors which we can prevent, isn't it? Genetics you can't prevent. Acquired thing is conditions like diabetes, hypertension, obesity. They all can enhance Alzheimer's disease.
Alzheimer's disease.
That's why in the concept of well-being and lifestyle, the main issues of diet, exercise, health check, and good sleep. These are the hallmarks for anybody, and more so people with Alzheimer's disease. I think diet, exercise actually plays important in old age. Diet is general principle. There is no particular dietary restrictions to prevent Alzheimer's. It's same as general health. You take low carbohydrate, high protein, not to eat processed foods, not to have high salt, which is very difficult from Indians.
Yes. Yes.
And then these we already mentioned processed foods. For children, the artificial drinks,
Right, sure.
Ready-made foods. So you have to restrict all those things. In the diet, I'm sure there are so like high fiber diet, like white bread.
Learning new things and reducing the chronic stress. Can you talk
I
about
think
these
in
two things?
the concept of well-being, where we talked of exercise, exercise means at least you do 150 minutes of exercise, active exercise per week, not housework alone. So exercise actually helps metabolism, so many other things. And now the cognitive stimulation is good. It is good to delay the process of dementia.
Sure.
And also cognitive stimulation helps once you get dementia to slow it down. So we have now in our dementia clinics cognitive stimulation treatment. So in that the activities which you are thinking, doing puzzles, keeping brain active
Sure.
is very crucial. Namely, being active in life, taking decision making, not rely on other people.
Sure.
That comes into that, I think. Yeah. But nowadays, more and more, as is all digital training and computer programs, maybe we have more and more such programs to increase cognitive stimulation. Can I also mention sleep?
Oh yes.
We
sleep,
often
yeah.
ignore sleep. Elderly people have poor sleep.
Yeah.
Not only dementia and associated mental illnesses cause sleep problems, but middle-aged people where it's fast life, ambitious, driving late, we I think sometimes ignore value of sleep from 11 to 7, whatever it is very essential, because poor sleep can trigger dementia.
Dementia.
And we see a lot of people with dementia, if their sleep is poor, they get confused. So we have to sleep management. But rather than having the sleeping tablets, healthy sleep habits are very vital. That's a different subject, how to have healthy sleep habits.
Healthy sleep habits. Sure. So I'm really concerned, even with my research, there is no kind of tests available at the moment. So there is no proper diagnosis, it seems, right? So can you just enlighten on that?
Yeah, I'll
please?
tell you, if I take you through how we treat patients in our clinics.
Yeah.
In National Health Service now, there are MAS clinics, that is Memory Assessment Service. It is a government stipulation, everywhere we should have MAS clinics, where we see dementia patients.
Sure.
It's a separate staffing, separate experts. So a general practitioner refers a case to MAS clinic. He writes a referral letter, usually elderly people with memory problems. Then they are discussed in our multidisciplinary team meeting to see whether referral is correct or not. Because sometimes people come with severe physical illnesses. So we post them for managing physical illness first, and then we can take care of memory. Once we accept them to memory clinic, they go through a screening process where a qualified nurse do the history, background,
Sure.
because every psychiatric workup needs background, history, lifestyle, what they did before. Their factor of stress also comes. Life profile they had, jobs they changed, houses they changed. When you take that history, lot of people think it's unnecessary, but lot of factors emerge when you take that history. And then also we do memory test. There are standard Adam Brooks inventory, MOCA. They'll give a rough estimate of the cognitive scores.
Right.
The first one is out of 100 point. The threshold is 80. If they score below 80, you start concerned. Above it is normal. Similarly, another test, MOCA, it should be about 25 out of 30. And also we go through whether all the medical tests are done. Because poor cognition can happen in a lot of medical conditions, like anemia, heart failure, and medications. People who take painkillers like morphine, they can have reduced memory. So they go through the history and also see necessary scans are done. As you said, CT scan, CAT scan is essential, not essential, nice guidelines in this country, which is the National Institute of Clinical Excellence. Everybody should have, if possible, CT scan and also ECG. And then there are further scans which we do afterwards. So after doing that, they are referred for medical consultation. So during the medical examination, there is the final step where a qualified psychiatrist will make the diagnosis, right?
Sure.
Now we have other practitioners like advanced nurse practitioners are able to do the same. So medic goes through the history and then decides whether anything reversible factors are there.
Sure.
Like excessive medication, other than by the mental illness. For example, a lot of mental illnesses can cause false dementia. That's very important. I forgot to mention it.
False dementia?
False dementia, pseudo dementia.
Okay.
For example, people with depressive illness also can have poor memory. They can get confused, lack of interest. So, if it's depressive illness can be misunderstood as a dementia.
Oh, okay, got it. Like, so there is this is also psychological problem. That is also psychological problem. So it's a difference. So okay.
So in the medical consultation, we try to exclude those conditions.
Sure.
And also chronic anxiety states, like students, an anxiety state can cause memory problems. So any reversible mental illness we diagnose and we treat it first, so that real dementia will come into more surface, becomes more clear cut. Like PET scan. The PET scan is done in some centers where it tests the oxygen intake of brain cells. It is said to be indicate Alzheimer's disease 70% of the cases. If the PET scan is positive,
right,
all of the tests I told you earlier, they are not. Even the rating scale above, below 80 is not a black and white.
Sure.
It's only relatively speaking.
Sure.
But PET scan, the other scans also coming. But other things you are questioning is for screening purposes now for MCI, mild cognitive impairment, they are calling the concept of biomarkers. Because MCI is mild memory, very difficult to say whether dementia or not. So amyloid, the pathology of Alzheimer's is to do with two proteins. One is amyloid.
Yeah.
It's a normal protein, but it takes abnormal step there. It forms plaques surrounding the brain cells, so that brain cells can't communicate with each other. And the other protein is tau, T-A-U, that forms entangles inside the brain cells, gray matter.
Sure.
So all these cells reduce the communication between the cells. So these biomarkers nowadays with blood, with the spinal fluid and blood are supposed to detect that.
Okay.
So if it are successful, it's still, I won't say pilot stage, but it is coming now.
Okay. Okay, it's really made progress.
Make progress, and everywhere future will have these MCI clinics.
Sure.
Where you can really predict a particular person with biomarkers may be prone to Alzheimer's, and you can start treating it bit early.
So basically the test goes to brain cells and then see whether it's talking to each other as a layman perspective.
Yeah.
So they're communicating each other as expected as a healthy brain.
Yeah. But that healthy brain Brahman protein can be detected now in the brain, and until now we don't have any test.
Sure.
There's no blood test for Alzheimer's disease.
Yeah.
But with this, we may be nearer to getting a blood test to detect Alzheimer's disease.
Sure.
That's
Sir, as you just mentioned, again, like, with my research, recently the Sweden, I think they got the one blood test. It seems like, with that one blood test, they can diagnose Alzheimer's. Pretty much like 70-80% there is a progress it made.
I think the same thing. They are in the forefront than UK. They are called biomarkers.
Biomarkers, okay.
It's a different term. Biomarkers means normal, you do blood tests, liver function tests, kidney function tests,
Okay.
electrolytes you see in the blood. They're all medical conditions. But to discuss neurological conditions, we don't have real blood tests.
Really?
We only have these radiological investigations, EEG, electroencephalography, those things.
Sure.
I think that the test you are talking about, Sweden and abroad, testing the blood, there's no real, the final detector at present. It's coming up now. So if the blood test shows this amyloid protein at a certain percentage, it gives a bit more indication. But there you act other compounding factors, where there's family history of genetics also. So if there's a family history of Alzheimer's disease, not only parents and grandparents, on the top of that you get a patient with memory problems early in life. And on the top of that you have these abnormal proteins, you are really heading from Alzheimer's.
My question, and most of the audience, so most of the people come to abroad, not only UK, Australia, anywhere, their parents, their family in back home. We don't have any system like this. And again, there is no concrete diagnose with this Alzheimer's or memory loss. And if someone have kind of experience, what you advise, you give it to anyone, me, if I want to take care of my dad, mom, or family members, or what advice, in back home especially, so since we don't have any proper setup there, so what sort of steps I need to take care of it?
I think it's a serious problem to our countries, because it's all priority, you see, because I know our GDP is increasing and all that.
Yeah, sure.
But still the priority of average Indian is physical health.
Yes.
He wants to get his heart treated, cancer diagnosed, anemia treated. All other conditions take priority. For them, both mental illness and dementia takes a back step. If an elderly man is a bit confused, they won't pay much stress, much importance to it. That's one factor. But gradually people are aware of it. But in India we have this skepticism. If something is not treatable, why bother? But in these countries, they are different. Even HIV, when we had them and not untreatable, we are still seeing those cases.
Sure.
Same thing, cancer, which is not treatable, we still have so many schemes.
Continuously, the charity will be there. Continuously, they're improving, they're raising the funds. That there would be continuity in development.
Yeah. So as resources are low, our priority is medical, and that's why people don't go to doctor that readily like they do here. And second is organizations like Alzheimer's Society and even the national governments are now asking us to increase the diagnosis. Now the Alzheimer's Society feels, even in this country, we're only diagnosing something like less than 40%,
right,
or
sure.
50%.
Okay.
Of course, the people's concept is why, as they are not reversible, why to bother? But a lot of things can be done with early diagnosis.
Yeah, exactly, sir. It's preventable, right? So now we are in social media age. It's not only our generation is different, because we are getting a lot of stress with the social media, so anxiety, the stress we are gathering. We cannot even compare. I've seen that so many people are young generation having strokes, having chronic problems,
Exactly.
and this will be lead to Alzheimer's, right? So there would be is definitely something we need to do something about.
That's an excellent point. Actually, that's what we have to now. Early diagnosis is important for that.
Yeah.
To prevention.
Yeah.
Even though there's no cure yet, there will be cure. There's a new type of intravenous infusions have come now. There's research being done. American Food and Drug, FDA, they already give a license to new type of immunosuppressive type drugs which are being used. They are called disease modifying drugs. So we are going to reach that stage. So very important to diagnose early dementia so that we can wait for the treatment. But more than that, as you say, as dementia can make worse by poor lifestyle, high blood pressure. In India, a lot of people ignore even the treatment of blood pressure in villages. If the dose is 3 times daily, they may not take it. It's improving now
Sure.
because they're expensive.
Yes.
The government funded programs are there, but they're less. Still, the diet habits are poor. So that will make them more morbid and ill. So I think the younger people should take all these well-being schemes like we do. And I think you mentioned stress earlier, and lot of stress relieving programs, not only exercise, meditation, mindfulness and yoga. I think they all should become part of our regular and we give priority. They do definitely help. There may not be great proof, but it is signs of healthy well-being.
Sure.
I hope I didn't miss your question actually there.
No. You answered the question, sir. So, when you mention there is no cure, why we need to take care of? If it is that mentality, if it is not curable, it's preventable is the priority. As you said, diagnosis. If I have a treatment, I can ignore. Okay, I have a treatment. But this Alzheimer's, we don't see impact now, 40s or 50s. If you don't take care of your diagnosis, if you don't think about it, if you don't take care of yourself, it's inevitable. There is a chances, and there is no treatment. It's gone.
Yeah.
For me, this is more concern. At least cancer have some sort of the curable thing, there is a kind of medication. But this is something is not really we don't have enough tests and we don't have any kind of resources. What I can see so lifestyle is a imperative or important, and early prevention is necessary.
Yeah. Actually, when we did the drug trials in 80s and 90s, see, apart from cure, as you know, most medical conditions there is no cure, really speaking. Hypertension, there is no cure. You take lifelong antihypertensive. Asthma, lifelong treatment.
Right, sure.
So it's not cure, what is called concept of quality of life. In the drug trials, one of the parameters we used was improving the quality of life.
Okay.
It means by improve the quality of life in such a way that will prevent you from, in this country, going into nursing home care.
Sure.
Going into sheltered accommodation. So if all these preventive measures can keep you fit and healthy,
sure,
even though disease is still progressing, quality of life improves at home. Means you can still look after yourself. You can have devices where you can be independent. I think an Indian concept that is missing a bit. We have to think of quality of life because we live in a society where we still think our relatives can look after us, which is not that much if we are living in cities and all that. So all the early diagnosis, taking all the measures can improve quality of life.
Can you talk about you also mentioned about the society care, nursing homes?
Yeah. I think in fact we should discuss it. Now, when I diagnose dementia these days, I only will say medical impact, medical role is only 50%. Rest medication, tablets.
Sure.
Other 50%, more than that, is social care. The social care includes to keep people in the community in their own home, they need a lot of care. That includes looking after their carers. In this country, so many people are kept at home, not by government to help, but carers. They struggle in this country also. There's concept from outside here, everybody is rejected. It's not true. Actually, 75% of elderly people are still looked after by relatives, neighbors,
Sure.
unpaid carers.
Okay.
So if you're looking after the carers, also keep them at home. So what is your question again? Oh, yes,
Yeah.
the care,
We talked- yeah.
the social care, and also to provide in the social services, assessing their needs and providing care package. Because a lot of elderly patients, their carers are also elderly. They are not young.
Sure.
They also need support. So having a care package. All this again is not to care, to keep the people in their own house as long as possible. The hallmark of treatment of dementia is they should be treated in their own environment as long as possible. Once we move them to a different environment, they get more confused and all that. But they reach a point in severe dementias, severe frailty,
Sure.
stroke, then you have these supported accommodations of various types, which are coming up in India also. They are like residential homes.
Yeah.
Two types of residential homes. One type of residential homes, care homes, look after people with physical frailty, but they're also specializing elderly mental illness who take dementia. And if it remains progresses further needing nurses, they have nursing homes. But before that, you have retirement places, Care Plus, where they have their own flat, but carers are available nearby. Actually, in India also they are coming up. Actually, that is a very good system for Indian culture. Elderly people with all their, earlier you asked the question, children are abroad in UK and America. So at least with their financial resource they have, they can have their elderly parents being looked after in their retirement flats, where there is a provision of carers, there's a surgery, a doctor coming in, and they have ambulance ready to take them to hospital.
Sure.
I visited them because my sister and my brother-in-law stay there in Hyderabad. I think they should be more promoted now.
Sir, any other aspects of dementia audience can worried about?
I think I said dementia is not only medical, social phenomena. Now our goalposts are changing a lot. Any dementia patient we assess, we have to comment on their capacity and advise them whether they should advise them everybody to have power of attorney. In this country, one power of attorney is for financial matters and property, so that they give attorneyship to their kith and kin whom they trust. It needs to be discussed.
Sure.
It is a procedure. And then second is will, to write a will, again when the capacity is retained. And also advanced life decisions. Advanced living will, we call it as. Advanced life, they can make a decision, so they can write it, namely, if I become severely demented, I don't want to go into intensive therapy, or I don't want to, living wills, I think we call, I may be using the wrong word here. They can make a decision now itself, so that relatives won't force treatment. And finally, in this country, mostly driving assessment.
Sure.
A lot of driving accidents, even though most accidents are not related to old age or dementia, it mostly due to young people with drug problems.
Sure.
But elderly, they need a vehicle to shopping to be independent, so they need a very careful assessment of their driving ability, and also help them to reduce their driving, to make it to small places, not to travel supermarket long distance, go to a local shop. So driving assessment is also becoming important. And also in this country, we have to advise them to apply for a lot of benefits. Even in India, if there is some government plans, people may not know. Elderly people with cognitive problems forget about it. So I think we have that medics, health, not medics, are you saying medic, but healthcare professionals have a responsibility to advise people with dementia to take care of this social legal dimension. That's
Sure.
it.
Sure. So these small, you can say myths, but it's a very short answers. Okay, any food that can be avoided to prevent dementia?
Food.
Yeah.
I think same as for, as I said earlier, diabetic. It should be high carbohydrate, highly processed, highly artificial,
Yeah.
with high preservatives.
Sure.
Should be avoided. And of course, people, you can't say you can't, but we should take care of people who eat meat also. In India, meat consumption may be less. And fresh food has to be fresh. And also high protein.
High protein.
And still, I think the vitamin, like this new, since COVID came, people's necessity to take vitamin D has become improved. Vitamin D sustains our immune system, especially people living in cold countries with no sunshine. Vitamin D is important. So the food-wise, that is mainly the fat, to avoid fatty foods.
Fatty foods.
Yeah.
Sure.
And have frequent health checks to prevent obesity. I think all the concepts of diet should come with exercise also.
Exercise. Yeah. Again, could be I'm repeating the question, but it's a different. What is the single most contributor for dementia? And it's short answer.
From my knowledge, exclude genetics, I still have to say lifestyle.
Lifestyle.
Where the fast lifestyle, modern life, we are doing a lot of wrong things knowingly. The other thing I forgot was, until recently, cigarette smoking, alcohol are main contributory factors.
Okay.
So now we think cigarette smoking is, we got rid of it, but still a lot of people are smoking. Countries like India, cigarette smoking can cause constriction of blood vessels, lung disease. We discuss this often in our carers meetings. At the end of the day, we have to see practicality. Everything in moderation. Still, chocolates, very difficult to ban them, even if they are a bit dangerous, but moderation, reduce them. I think we should not eat too many sweets. I started a process in our Christmas meal meetings with the department. For example, when you order a dessert, each person doesn't need single dessert. You can have one dessert which we can share among 3-4 people. Because you only have dessert for the sake of taste, isn't it?
Yeah, just satisfaction.
Not for quantity.
Yeah.
So we can so many things.
Yeah.
Like drinking coffee.
Yeah.
Most of the coffee, but we can reduce the coffee. Other well-being course I attend by BAPIO is, you should need plenty of water. Real water content should be nearly 4 liters, at least 2.5 liters. Now in this country, we always carry water. To go deviate a bit. In India, I'm so much surprised why most of us never carried water. I heard recent story, communist...
It's a hot country.
Hot country.
It's a cold country, we'll carry water bottle wherever we go. But the hot country, they're not really carry water.
Recent, I heard a lecture on WhatsApp, professor saying, what is the commonest cause of confusion in this community?
Sure.
Commonest cause of confusion is dehydration.
Dehydration. Okay.
I think in India, even at school, we didn't have a drinking water. We couldn't carry water. At the end of the day, I'm sure remember becoming irritable, weak and tired. And go to the doctor and have a lot of tonics.
Sure.
I only recently we realized why water is important. I don't know in India, I think they are carrying water. Dehydration can cause a lot of problems.
Sure. So thank you answering me so many questions with your time. So again, this is, you already mentioned, Alzheimer's always genetic? No.
No, there is a genetic contribution. If there, as we say, if there is a high incidence of Alzheimer's in the family, namely grandparents and parents, these offspring should have genetic counseling. As far as I know, the genetic therapy not yet available where you can do the gene therapy. But if you know there's preponderance, going back to the earlier point,
Sure.
we can take precautions, more precautions. I have a friend, my own colleague, he has been really taking utmost precautions from the age of 20. Because in his family, his grandparents, parents, 2, 3 brothers, they all died of heart disease and heart attack.
Okay.
Now he's taking so much precautions,
Right.
so much, the saturated fats in his system is not
Sure.
high. And he's surviving very well at the age of 80. So it is not, we should not be fatalistic. A lot of things with modern knowledge we can prevent. So if you do genetic counseling, we can do, it doesn't mean definitely you get demented, but you can do a great deal of things to delay the process.
Sure. Sir, one last final question. So you do charity work, including your involvement with the Blackwood Alzheimer's Society and educational initiatives in India, demonstrate a commitment to making a lasting impact. What drives for giving back, and what advice to others looking to make the difference?
I think we are all learning. India, religion like Hinduism, Islam, all countries teach charitability. But after coming here, I must say in Christian countries, the concept of charity is very high.
Yeah.
I myself read in Christian college because they always say a certain percentage should be sent. It is there written in their. I think if you are able to learn your own livelihood, have a good family, some earnings, we should be able to give back to the society from which you came.
Sure.
I think Vedas, I can't really quote the correct slokas, but Gita says that. And also that gives enormous pleasure. People don't realize that.
So give or take, giving is more the satisfaction.
More satisfaction.
Yeah.
And once upon a time, I used to think lot of amount in the bank is the one is not. Amount in the bank, giving it to your own children never makes you happy. Once you make them independent, that's real theme I will say to all of our NRI people.
Thank you.
They don't need distribution from us. If they're independent, let them earn. Whatever assets we have, we should distribute. There are so many vulnerable people in India, in our own village, even this country also. So I think giving back concept, I got a bit late in life because when you do MBBS, initially you want to struggle to strive on your own. But we should develop from early, from student days. I have
Sure.
colleagues from student days, they were going and doing health screen in villages. So I think the charitability, helping others, which our scriptures say should come into that. Then I can really say it gives you enormous pleasure to give back. If you do one project, then you feel like doing other projects. It doesn't mean you are
Right.
misusing money,
Sure.
but you'd organize it properly. A community hall in my village, which I did, and name of my wife, she passed away 12 years back. But village is benefiting a lot.
Sure.
And also help the temples. Temples need reorganization.
Sure.
Lot of temples are, I know people think God can look after himself, but temples are very good social structures in India.
Yeah. Yeah.
People go there, lot of activities are there. I think we should give back to the society, and the society will look after us.
Absolutely, sir. As per as you said, Gita, so service is the most satisfaction thing. You involve in the service, that is the real spirituality, right? I have a great subject, but that could be another episode. But thank you, Dr. Bapuji Rao Garu. Namaste, and we are blessed to you come onto this show, blessed us. We are beginning of the video podcast. We would like to impact as many as we can. But thank you so much for your coming all the way from Wales, driving here, staying here, blessing us. Thank you so much. Namaste.
Namaste Syam Kumar Garu, Namaste Surya Garu. It's a great privilege. I'm really happy in this interview. I'm able to really bring up a lot of my stored knowledge, which I never did before. I hope your audience will benefit from it.
Thank you, sir.
Thank you.